Hello everybody, I'm Dr. Taher Ahmed Shaikh, the Senior Consultant in Liver Transplant, Hepatobiliary and Pancreatic Surgery in Fortis Mulund and Fortis Hospitals. I'm just going to talk briefly about when do the surgeons recommend a liver resection over a liver transplant. So we need to understand that liver resections are basically done when tumors involve the liver and the remaining liver tissue is healthy. Liver tumors can be in the form of benign or malignant. The benign tumors can be either cystic lesions, that is tumors having fluid inside it, or they can be solid tumors called as a liver cancers or hepatocellular carcinoma or intrahepatic cholangiocarcinoma. There can be other types of liver tumors also, but these are the more common ones. So the surgeon will advise a liver resection for liver tumors or liver diseases when the remnant or the remaining liver tissue is healthy. We can remove up to 2/3 or sometimes even a little bit more than that of the liver, diseased liver, if the remnant liver tissue, liver parenchyma is healthy. For example, we can proceed to leave only the left lateral lobe, which will be approximately 30% of the liver, and remove the remaining right lobe and some part of the left lobe. As compared to liver cirrhosis, liver transactions or liver resections are going to be safe when the patient's remnant liver is normal and the patient does not have chronic liver disease in the form of jaundice or fluid buildup in the body. However, what happens in cirrhosis is that repeated damages, injuries to the liver parenchyma causes the liver to undergo repeated episodes of so-called repair, that is regeneration, which can be in the form of either nodule regeneration or scarring, that is fibrosis. When the nodule regeneration, scarring, fibrosis happens on a perpetual or long-term basis, the liver parenchyma is basically going to be replaced by a cirrhotic liver, that is regenerative nodules. That means this liver is not going to be functioning like previously, and approximately 2/3 of the liver, or approximately around 70% of the liver, has to be damaged perpetually or chronically for symptoms and signs of liver cirrhosis to present. When the patient has a cirrhotic liver, and also unfortunately liver tumors, which happens in about 10% to 15% of cirrhotic patients in the long term, either because of hepatitis B, hepatitis C, alcoholic liver disease, metabolic liver diseases, or the modern epidemic of non-alcoholic fatty liver disease because of obesity, it may be difficult to remove the liver tumors in a cirrhotic patient. This is because there will be increased chances of bleeding or the patient going into liver insufficiency or liver coma post-surgery. So usually we as surgeons will advise you to undergo a liver resection for liver tumors if the remnant liver tissue or liver parenchyma is healthy and can cope up with the remaining parenchyma. However, as I mentioned previously, if the liver is going to be cirrhotic, then it is unsafe to carry out a major liver resection for these patients. However, early cirrhotic patients who have not had any fluid buildup or any bleeding or any episode of hepatic encephalopathy, that is altered sleep movements, altered sleep behavior, and altered mentation, can undergo a minor resection, for example, just a small wide local excision or a metastectomy or a single small lobe removal, for example, the left lateral lobe of the left lobe. So those surgeries can still be performed in early cirrhotics because the patients are not decompensated, they do not have jaundice, they have not had episodes of hepatic encephalopathy, or they have not had any fluid buildup in their body. Thank you.